Welcome, Dana McLaughlin, today's webinar.
Thanks, Alma. It's nice to see some familiar people on the call and great to see you as well. Alma and I, I've had the pleasure of working with Alma for many years now, and it's always nice to be able to see you, even though we're not in the office like we used to be. So like Alma said, my name is Dana McLaughlin. I am currently a global health associate on the global health team at the UN Foundation, but I previously was on, more exclusively on the Nothing Bednets team and haven't really been able to escape Nothing Bednets in a good way. So I still manage our grant portfolio with our UN partners and non-UN partners. And so today I'm going to be talking to you a little bit about why Nothing Bednets has made a commitment to protecting last mile and displaced populations from malaria. A little bit of background about why malaria impacts displaced populations and populations that are facing conflict and crisis. And then also just a little bit more about some of our programmatic grants. And hopefully we can then open it up for some question and answer so that I can provide you all with some more information as you are, preparing to meet members of Congress and hopefully can share some of the work that NBN is supporting. So just more broadly, I want to start out by talking about, why NBN is so focused on last mile populations. And I don't know why my slides are not turning. There we go. Okay, perfect. So malaria, is one of many, many challenges, not just health challenges that displaced populations face, but it is a leading cause of mortality and morbidity among displaced persons. And there are many different individuals that fall into this category, and it's really an ever-changing definition. So for our sakes today, when I talk about displaced persons and the new estimates from the UNHCR, the UN High Commission on Refugees estimate about 8.24 million displaced persons around the world, which is the highest it's ever been. That term displaced persons really includes refugees, internally displaced persons, or what we call IDPs, and then also just some more irregular migrants, which might not neatly fall into the buckets of refugees or asylum seekers or internally displaced persons. So that's really a broad category. And today, our work predominantly focuses on refugees and internally displaced persons. But that work is definitely concentrated in areas that that have high malaria endemicity. And UNHCR actually estimates about 2/3 of people of concern or these displaced persons live in malaria endemic regions. And so that's really why we feel it is absolutely critical for Nothing Bednets and the larger global malaria community to address the challenges that these individuals around the world face when they're trying to keep healthy and keep their families healthy. And we know that, displacement often is kind of doubly burdened by not just conflict, but also limited access to healthcare and health services. And that can also drive really rapid increases in malaria cases following an emergency or a conflict, whether that be violent or natural disasters. And so we know that malaria needs to continue to be a priority to protect the health of displaced populations around the world. And so one of the things that UNF and NBN more broadly have done is worked with the Global Fund and with the UN High Commission on Refugees to actually do a mapping exercise. This is just a snapshot of some of our work of really looking at where is that overlap. So we know that there's, so many millions of displaced persons around the world, but really, where are those settlements? Where are those refugee settlements? Where are those internally displaced person settlements? And then how does that overlap with the malaria burden around the world? And so you'll see here, all the different colors here represent sites where refugees, internally displaced persons have settled and or are awaiting their asylum cases to be hopefully resettled in a safer location. And then also the blue kind of shows you a map of where malaria incidence is the highest. So where the higher rates of malaria cases and deaths are. And so obviously, as many of you are familiar with a lot of our work, those rates are unfortunately quite concentrated in sub-Saharan Africa and specifically concentrated in countries where there really are high rates of displacement. So we know that kind of cross the intersects of those two issues, both malaria and displacement, create really a challenging situation, especially because the typical tools that we would use to combat malaria in, a community are not always effective or appropriate for refugee and displacement settlements. And so that's really where some of the challenges lie. And some of our work with UN partners, which I'll get into later, is just really starting to create new solutions and problem solve around how to keep these extremely vulnerable populations safe from malaria. And so I don't need to go through all of these, but this is just a real snapshot. And I can share this presentation with you afterwards, so you have some of these statistics in your back pocket when you're thinking about your upcoming meetings or engagements with your members of Congress, thinking about, why is malaria an important issue for displaced populations? Just last week, we celebrated World Refugee Day. And part of that is really recognizing the immense obstacles that refugees and all displaced persons face, and also making sure that leaders around the world, both here in the U.S. and internationally, understand that we do really have a role to play in protecting the health of these individuals around the world, and that comes in the form of continued support for the Global Fund, amongst so many other international funding programs and global health initiatives. And so, especially looking at displaced populations, we know unfortunately, the majority of displaced persons are women and children, and those individuals are often sometimes the most vulnerable for malaria, especially pregnant women and children under 5. And so those are the specific populations that we also work to target and prioritize in our own granting and in our work with our UN partners. And then I already spoke to this a little bit about the challenges that are, multifold in terms of malaria in displacement areas. And that can start with just the simple fact that when you're in a temporary shelter, in a tent, or in a makeshift dwelling, oftentimes the traditional malaria tools like indoor residual spraying, or even a place to properly hang a bed net, are just not appropriate and not effective and not realistic for many people. And so the ongoing challenge is, how do we continue to address the growing demand of protecting these displaced persons from malaria, especially in those high burden settings and in those high burden areas of countries around the world. And then in addition to that, we know, and COVID-19 has showed us this once again, is that when health systems are disrupted, whether that be because of a global pandemic or conflict or a cyclone, that breaks down the chain of malaria services. And so not only can it delay shipments of nets and shipments of other commodities, of medications, but it can also wipe out healthcare services. It can prevent healthcare workers from going to meet the needs of the populations that they work with. It can wash away health clinics and settlements, and really add additional barriers to people's ability to seek care, to their ability to seek rapid diagnosis and treatment for malaria. And so we know oftentimes in settings, especially after natural disasters or after violent conflict, the increase of malaria is quite drastic because of the broken down access to health services. And so today I want to just shift the focus of our work and really put it in perspective, because I think it is important to remind everyone that, Nothing But Nets is very much an advocate for the UN agencies and the people who do the incredible work every day on the ground. And I think it's important to understand too that there's no one from Nothing But Nets out in the world delivering bed nets or providing rapid diagnostic tests or malaria treatments, but rather the hands and feet of our organization is our UN partners and our non-UN partners as well, who are the front lines of the fight against malaria. Much like this woman pictured here, who's a healthcare worker in a refugee settlement in the DRC. These people are sacrificing every day and working hard every day to make sure that people, especially women and children, are staying safe and protected from malaria. And this work is incredibly difficult, and especially over the past year in the face of COVID-19, I think it is really important to center our conversation and recognize that our work as advocates is important, but we do what we do so that people like this have the support they need to continue their life-saving work. And I think that when I think about the core mission of NBN, it's really making sure that healthcare workers like the one on the screen here have the tools that they need to continue fighting malaria, and especially in these displaced populations and in refugee communities. And so I spoke briefly about, we saw on the screen, but this is just another way to think about those high burden countries. The 11 here actually carry the highest burden of all countries in the world. And so what Nothing But Nets does when we're trying to determine where we want to prioritize our small piece of the funding puzzle is looking at where communities, especially displaced populations in these countries, are in the most need, and really where we can fill the gaps, because we also have to recognize that the funding that NBN provides is just a small drop in the bucket compared to the President's Malaria Initiative or the Global Fund. But what we are able to do is kind of uniquely fill some gaps that other funders and organizations cannot fill. And so that's, I think, the really essential value add of Nothing But Nets' granting work. And so kind of speaking to those priorities here on the screen again are just outlined what I look at when I receive a grant proposal, really thinking about not just the malaria burden, but also the larger context, the larger healthcare system needs, and then also the specific population. So, like I mentioned, pregnant women and children under 5 being of the utmost importance in our priority setting for grants. And so there's some countries on the screen there, and I think there are really 2 settings here where we think about our work. One is, and they're very different. I think it's also important to note that no 2 countries are alike in their fight to end malaria, and that it really takes local expertise and tailored customized plans to tackle malaria in each country. And so in a country like Ecuador or Haiti, where they have very few malaria cases every year, but are really reaching that elimination milestone, our approach and our funding is very different there than in Niger or the DRC or South Sudan or Nigeria, where we're currently working, just because the needs are different. The response must be tailored to the local needs of the epidemic and also of the population, because I think we as a global health community have far moved past the one size fits all model, and really it has to be not only locally led, but also meet the needs of the people who are trying to stay safe and be healthy. So I think that's a really important thing to note when we talk about Nothing But Nets' granting. This is just a broader map. I just mentioned the elimination countries, and these are just kind of a picture of, we have made notable progress, but there really is some countries that are on one side of the spectrum where they're getting close to malaria elimination, Haiti, Ecuador being some of those. And then there are countries on the other side of the spectrum which are, making noble efforts to control malaria, but there are immense funding needs, some of which will be met hopefully by the Global Fund and by the President's Malaria Initiative, but advocacy efforts need to be continued and sustained, because we want all countries to have the opportunity to say, they're approaching elimination. And I think Nothing But Nets will, continue to be one of the strongest advocates for the fight to end malaria, even as we get close to the finish line. We know it's easy to slack off and kind of lose some of the steam that we've made. And then, so I talked a little bit about, what our grants fund. And I think one of the really unique things, and one of the things that excites me about our grants, is that it's sometimes, it looks different in every country. So the picture here on the screen is a photo of a tablet that was used in 2 provinces in Haiti to track malaria cases. And this technology is, both a unique story in that it was a part of a larger partnership with Samsung, and other partners across, the private sector and then the UN system as well, but also thinking about how, sometimes the tools that are needed are not always the tools that are best funded. And so that's where Nothing But Nets can step up to the plate and say, what, we can help support a partnership that provides healthcare workers with the tablets they need to track malaria cases. And I think, this is one unique example of arming the healthcare workers on the front lines with the tools that they need to combat malaria. And there are many others. One of the other things I wanted to highlight and talk about today is the fact that when we think about protecting and providing the tools that refugees and displaced persons need to stay safe, even as their situation is tumultuous and unpredictable. One of the ways that we do that is by providing in the core relief item package, which is the thing that refugees are when they arrive at a new settlement, they receive from UNHCR. Providing a Bednet as a part of that package has been something that Nothing But Nets has been prioritizing for the past 5 years. And I think that's something that we will continue to prioritize because we know that by providing someone with a Bednet, not only is it enabling them to take charge and protect themselves and their family, but it also gives them some comfort and some peace of mind as they're arriving in a brand new setting with very little personal items. And it gives them that kind of sense of comfort so that they can sleep soundly at nighttime. And then obviously you guys, Nothing But Nets is known for the name most likely in providing Bednets, but I think there's so much more beyond Bednets, and that Nothing But Nets has historically provided everything from rapid diagnostic tests to training of healthcare workers, paying the salary of healthcare workers where otherwise they might have gone unpaid or just worked on a volunteer basis. We know that, the longer and the more sustained healthcare worker training and the longer healthcare workers work, the more experience they gain, the more experience they build and capacity they build within their local communities. And so we think that, empowering healthcare workers and giving them the tools and the salary that they need to not only provide for their communities, but also provide for their own families is essential. And so that's something else that Nothing But Nets will continue to fund. And then obviously more largely, it's not just about providing someone a Bednet. I think, that's an easy thing to think when you think about Nothing But Nets maybe from the outside. But what I hope you all will take away from today is that, we've learned that, these initiatives and these programs cannot be just as simple as providing someone with something like a Bednet. It has to be a holistic wraparound program. It has to start with providing antenatal treatment and providing a pregnant woman with preventative treatment for malaria when she's pregnant, giving her a Bednet, and also teaching her and her family how to take care of the Bednet so that it lasts for 3 years. And then also making sure that that individual, that family has the nutrition they need, or the nutritional foods that they need to stay healthy. It makes sure that they have a safe space to live. And so that really is thinking more long-term rather than short-term about Nothing But Nets' work. And while we might not fund the nutritional side of things or the shelter side of things, that's where our partnership with UNHCR becomes something so much bigger. And so I think it's important to think about this idea of wraparound services, not just here's a Bednet, have a great day. It has to go beyond that. I think that's what we owe to the healthcare workers that are doing this work and trying to sustain malaria control efforts, and then also to communities that are facing unprecedented challenges and burdens, especially in the light of COVID-19, and giving them that sense of, we're not just going to be here one day and disappear, but rather building sustainable, long-lasting, community-led initiatives and programs to combat malaria so that they are long-lasting. And then, what happened to my slide here? Yeah, so I guess COVID-19, we could talk all day about the challenges that COVID-19 has placed on malaria control and interventions around the world. I think one of the things that the global malaria community has learned amongst, the rest of the global health community is that we cannot fund vertical healthcare programs. We have to fund programs that are comprehensive, that are interlocking, and that are, more threat agnostic rather than being threat targeted. And so we can't just fund a health surveillance program that looks at malaria, but also at coronaviruses and at other infectious diseases. And building a health surveillance system should entail not just, training people and providing them with the tools and the technology they need, but also making sure that the funding doesn't disappear after 2 years, that kind of idea of strengthening global health security also includes a narrative about malaria. And so that's really where I think of the challenges, but also the opportunities that COVID-19 and lessons that we've learned from that. And then lastly, I think, we could talk a lot more about our partners. And like I said earlier, they really are our hands and feet, the ones who are doing the hard work on the ground. We're just kind of sitting at our comfortable desks in our comfortably air-conditioned homes, helping behind the scenes. But this work would not be possible without the many partners on the screen here and so many others that are not pictured here. So that kind of concludes my presentation. I'll go ahead and stop my screen share, but hope we can open it up for some questions.
Yes, thank you so much, Dana. That was fantastic. It's always great to get a chance to hear you speak.
Yeah.
I'm going to pass it over to Monica, who has our first question. If she wants to elaborate, she can. But she asks specifically what Nothing Bednets or our partners are doing in Ethiopia with the regional conflict and resulting refugee crisis that we're currently witnessing. Monica, if there's anything else you'd like to add, feel free to take yourself off mute for a second. Okay, I'll pass it to you, Dana.
Great. So thanks for the question, Monica. So I just had a conversation with UNHCR a couple weeks ago about the Tigray region and the ongoing sustained conflict and crisis that is happening and unfolding there. One of the things that is challenging sometimes is getting resources from here to there. And so I think one of the things, the logistics of getting the aid to the people that need it is sometimes frustrating and sometimes challenging, but what we like to think about in terms of our partnership with UNHCR specifically is providing them with upfront funding that allows them to respond to emergencies like Tigray and so many others, so that they actually already have the cash in their accounts to start rolling out and deploying the tools that are necessary to keep people safe from malaria. And so one of the ways we've done that is through our emergency grant portfolio. And we actually are having discussions now about some support for the Tigray region. Nothing's confirmed yet, so I can't speak further about that, but know that we are thinking about it and definitely prioritizing filling any needs that are related to malaria for our partners.
Thanks, Dana. We have another question here. Monica, do you want to try to unmute yourself again? Or if not, I can give you access to speak.
Now I have it. Thank you so much. Thank you so much for having this timely webinar. I think this is the perfect time to discuss this. Thank you so much for answering what's happening in Tigray. I think I also was curious to know what's happening to deal with, there are a lot of refugee camps, people impacted by the Syria war and, other places in Middle East. There is unclean water, unclean sanitation. Mm-hmm. Children, especially in these areas, are very prone to malaria. I just was curious what efforts or what things are being done to handle that. Thank you very much.
Yeah, great question. And this is a question we get a lot is, why don't we have a stronger presence in the Middle East? And the easiest answer to that is we try to respond to the needs of the UN agencies that we work with and the non-UN agencies as well, but some of the partners that we work with on the ground. I feel like it is not my place or anyone on our team's place to sit back and say, well, there's problems here, we should do this, because we don't have the solutions. And we also don't fully understand the conflict and the challenges and the need because we're not there on the ground. And so that's where we rely, the eyes and ears on the ground of our partners to say, there is a clear need here. Not to say that there's not necessarily a need in places like Syria and other conflict regions in the Middle East, but we really depend on their ask and their kind of raising to us the need for malaria specific resources. And while the needs for wash and hygiene, sanitation, nutrition, and other things might be clear, that's not necessarily something that Nothing Bednets is designed to fund. And so we really are dependent on and defer the decision making around what is the most critical gaps that need to be addressed and filled to the partners that are on the ground. And I don't necessarily ever go to UNHCR and say, hey, we want to fund a program here, like let's start it up. And that's just it's not an appropriate way to address some of the needs, even though there are many deserving areas of the world that could use attention and could always use more attention. I think we really just have to defer to our partners.
I understand. I just wanted to, understand. I understand the logistics issues. I have worked in Ethiopia and Kenya and Tanzania. Mm-hmm. So I do understand the logistics very well, but I was curious, especially since a refugee attention, in my experience, is when an incident happens. And then over time, like for right now, everybody is interested a little bit in Ethiopia and Tigray. But I think a few months down the road, people forget. And that's where the diseases, especially malaria, measles, need more attention over the period of time.
I couldn't agree more. Yeah. And that's really where that sustained funding, it's not just, the rapid humanitarian response. And that's something that, the broader humanitarian community is trying to get better at, because it's not responsible. It's not ethical to go into a place, drop all this aid, and then say, okay, our contract expired, we need to leave. But really trying to have that more continuity of care and of services. And so I think, that goes for malaria as well as measles and so many other areas of work. And what we like to think about is called the humanitarian development nexus. So it's where that bridge between immediate crisis response, humanitarian actors, and then long-term development partners, how they meet in the middle to provide sustainable and continuous funding for health initiatives.
Thanks, Dana. Thanks, Monica. We have a question in the chat here. Actually, I'm going to go in the reverse order. Sorry, I know I just said Rosemary, then Juan, but we have the written question, then I'll pass it over. So I'm just going to read this one out from one of our champions. It asks, if a 3-year malaria-free country has a new imported case, does it mean the country is no longer malaria-free? And then we'll go to Rosemary, and then I see one more in the chat.
Yeah, so actually that's a great question, great distinguishing question. So imported cases, I mean, the US has over 5,000 imported cases of malaria every year. And actually in the past 2 years, it's been higher than ever. And so that doesn't mean necessarily that the US, for example, would lose our malaria elimination certification, as long as it's not domestically transmitted. So there's a key distinguish there of, being imported versus someone getting malaria here in the US. And that's where that distinction lies. So if it is an imported case, a country would not lose their certification.
Awesome. Thank you so much. I'm going to unmute Sister Rosemary.
Thank you. Can you hear me?
Yes, we can.
Yes.
I wanted to ask about vaccines. And also, I lived in Zambia for 8 years and took chloroquine weekly and did not have an attack while I was there. But 5 years after I was home in the United States, I began to have attacks. And we discovered that I have a resistant strain. And I'm just wondering if there are any other protocols being used now. I was in Africa in the 70s.
Yeah, that's a great question. So insecticide resistance and drug resistance are two issues that are on the front of our minds. If I could speak for the global malaria community, I know that that's an ongoing challenge and one that's likely to increase as we think about the next 2, 3, 4, 5 years of malaria work, because a lot of the tools that we do have, including some bednets and other insecticides and some medications as well, there is resistance developing to those. Chloroquine's a great example of that. And one of the things that is concerning is that the pipeline of new tools is a slow process in order to develop new drugs and new tools that mosquitoes are not resistant to, or that the parasite's not resistant to. And that's something that the kind of, we talk about research and development, or R&D, is a priority, not just for the U.S. government to protect our own individuals, our own citizens, our own foreign personnel working abroad, our own military, but then also obviously to protect individuals who are living in areas where we know there is insecticide resistance. So the first example that comes to mind is Southeast Asia, the kind of Mekong region, and Southeast Asia has really notable rates of insecticide resistance and drug resistance for some of the leading malaria treatments. So that's a huge concern, and something that additional funding for things like the Walter Reed Army Institute that are doing a lot of the research, not just on vaccines, but on some of these new treatments and diagnostic tools that will kind of counteract that resistance and provide some new resources for the global malaria community is ever more important. And so I think, as you think about your advocacy efforts, I know you all have spoken, perhaps maybe Alma can correct me if I'm wrong, about the Walter Reed Institute for Army Research. And that's something that, is US funded, that impacts the work of malaria efforts around the world, and something that if it were to lose funding, especially for things like the malaria vaccine, which are so promising, it would be a huge setback and a huge roadblock for the malaria community.
Thanks, Dana. And I have one question here from Marsha. I'm going to add a bit to it because I think you've more or less addressed it in your last response about just kind of where we are with the malaria vaccine and what information we can share. What would be, so this is me kind of adding to that question, what would be the obstacles in implementation distribution of a malaria vaccine? Are there challenges that we'd have to prepare for, or do we have an existing infrastructure based on the work that we've done with Gavi and our vaccine alliance, the Vaccine Alliance, similar to Shot at Life?
Yeah, so I am not a malaria vaccine expert. I'll say that to start. I don't even feel like I can say comfortably, I don't even know for sure the efficacy rates of the current trials. I know that there are trials being conducted in 3 countries in sub-Saharan Africa, and the efficacy has proven to be, better than any other malaria vaccine that's been tested before. But there is still, quite a few steps to go in terms of, its long-term effectiveness. And then also, I think, that's a great question, Amma, about just the logistics, because that, as we've seen with COVID-19 vaccines, is, you can have the vaccine and it can work, but getting it to the people who need it the most is sometimes the biggest challenge. And so I think, like you said, learning lessons from Gavi, from the Global Vaccine Alliance, from our polio partners, from our measles partners, from our other immunization counterparts, and addressing those challenges and conflicts and issues in the bottlenecks in the process of research and development before we get to the stage where we need to provide it to large scale populations is essential and critical. I think the funding is probably the biggest challenge that stands in the way of the vaccine right now. It's hard to say, oh, the COVID vaccines, so sexy and on the top of everyone's mind, and so obviously very important, but things like the malaria vaccine, or heck, even the HIV vaccine that's been in development for 20 years now, are also really important for people around the world. And the level of funding that we've seen for the COVID vaccine will probably never exist for malaria vaccine, because the people around the world who face malaria on a daily basis are not the people around the world who have control of the resources that have been rallied to fund the COVID vaccine. And I think it's very, this past year has been very clear about when a health issue impacts the world's wealthiest people with the wealthiest countries, how quick the response can be if people want it to be, and how very, very, transparently clear it is that when something like malaria is not a priority, it doesn't impact the wealthiest countries of the world or the wealthiest people, then it's not a priority. And that's, a very, very hard reality to stomach. And I think the more we kind of use not only the thing that we've learned from the COVID vaccine, and that, everyone in the US has now had an opportunity to get it, but people around the world might have to wait 2-3 more years to get it. So learning from that lesson as well is going to be really essential for the malaria community.
Thank you so much, Dana. I think that is definitely one of the biggest takeaways from, of the many lessons we've seen about the importance of health systems in this past, year and 3 months or so. I think that is truly the most eye-opening experience of all, is seeing that global health and health access really is an economic issue. It really does fall along the lines of access and who is seen as significant in the global landscape. Again, when COVID hit our borders, there was fast action. Right now in DC, we have some of the highest rates of vaccination in the world, to the point where some folks are even saying they don't want it. We have excess resources, and around the world, we're seeing that that inequality just shows itself. And I think those are huge lessons that we can take and apply, like you were saying. The same urgency that was applied to COVID, we hope we could apply that to malaria efforts. Unfortunately, we've not seen that. And as a reminder to the champions, shameless plug, but this is where advocacy comes in. This is the importance of having a network of hundreds of thousands of people who can be mobilized to reach out to the members of Congress and stress and emphasize that although malaria may not exist on our borders, we care about the people who are impacted, and we want to make sure that they have the same opportunities and access to health, education, economic opportunities that we have. regardless of where they live or what other factors they experience. So again, to our champions, I don't see any more questions on the chat, so I just want to thank you for making time. These little conversations that we have every 2 weeks or so are a critical part of your training, and hopefully prepare you to have these conversations with your elected officials and stress to them the importance of global health, global borders, and access to folks, especially right now, as Dana shared, displaced persons and refugees. And so thank you again. Thank you to Dana for making time today. Please make sure that if you've been on this call, you take a moment to take a screenshot of this page if you haven't done so already, and post it on our STAR tracker so that you can receive points and that we can see who amongst our champions attended this training. So I'll stay on for a few more minutes. I want to give Dana another chance to say goodbye before we log off. And thank you everyone for attending.
Great. Thanks, Alma, for the invite, and great to see you all. And like Alma said, these conversations are really important. And the more we are straight with our leaders, with our representatives about these issues and about the reality of global health disparities around the world, especially for displaced populations and refugees, that's something that will always continue to be a priority of Nothing But Nets. And we hope that we're giving you the tools and the resources to take these really important talking points to them and continue to advocate for the health of people around the world. So thanks for joining. It's great to see some familiar faces, and yeah, have a great rest of your great start to the week, but have a great week, everyone.